Okay, so once again, this webinar is on delegation and assignment making questions, and we'll go ahead and get started. So before I do, I want to briefly remind everybody that we have a very active Facebook study group page that we'd love to have you join if you're not already a member. So you will see here in this red box on that slide that there is a link to invite any of your friends or your peers that are also studying for NCLEX or are in nursing school with you. And you also can share the link to give everybody else access to these wonderful resources. So today, during this webinar, we are going to talk about general principles of delegation and assignment making. We are also going to talk about the nurse's role in delegation, and we're going to talk about a couple of resources that we can use to help us delegate appropriately. So the reason I love doing webinars or creating questions on delegation and assignment making is because I can guarantee you it is one of the topics that you will see on NCLEX. So NCSBN, which creates the NCLEX, gives us access to the test plan. So we know what is on that NCLEX. And we can see here on the slide, this is just the general NCLEX test plan, but you can see management of care counts for almost 20% of the exam. That's a really big number. So management of care includes topics such as prioritization, delegation, and assignment making. So I say all that to say, I guarantee all of you guys that are going to take NCLEX tomorrow or over the next couple weeks, you will see at least one delegation item on that exam. So once again, guaranteed on NCLEX. And you might be wondering why. Well, even though we think of delegation sometimes as just asking somebody to perform a task, it is actually one of the most complex nursing skills we use. And it is also one of the biggest safety issues that can negatively impact us as nurses as well as our patients. And we know that NCLEX is a safety exam, so they're always going to include this really important safety issue. So once again, it is a complex nursing skill. And we use it all the time, and we're using it more than ever before because we know that there's always nurse staffing issues, there's more patients to be seen. So we, of course, need to know about delegation for the purposes of NCLEX, but also we really need to understand it for clinical practice to protect our patients and our license. So before I jump into the resources and the questions, I want to briefly just clarify the difference between delegator and delegatee so that the rest of the webinar makes sense. Delegator is just the nurse that is asking somebody to perform a task. So that's the delegator, it's the nurse. And then the delegatee is the individual that is responsible for completing that task. So 2 helpful tips I want to go ahead and just stress right now that we can use as we navigate these practice questions on the next couple of slides. The first one is we don't delegate tape tasks. So tape tasks, it's just a good memory tool, but it's basically saying we're not going to delegate steps of the nursing process that require clinical judgment. So these include teaching, assessment, planning, and evaluation. That is the registered nurse's job. I also see somebody put in the comments, do not delegate what you can eat. That's another good memory technique, whichever one works for you. Same concept. The nursing process, the registered nurse should be responsible for. And then lastly, this is a very, very important tip. We only ever delegate routine tasks for stable clients. So if it's not a routine task or it's an unstable client, automatically we should be able to rule that option out and we know it would not be appropriate to delegate. So I know that many nursing students and new graduate nurses really struggle with some of these management of care topics such as delegation and priority setting, and that is because you just don't get as much practice doing these skills before you get out into the real world and you're in practice. So one of the best tips is to use our resources. So when we're talking about delegation, there are 2 resources we should always take into consideration that are going to help us make sure that we are delegating appropriately. The first one is the care provider scopes of practice. To put it simple, that's just what can everybody else on the nursing unit do. So everybody's scope of practice, what are they allowed to do legally? And then the 5 rights of delegation. So both of these resources are really going to help us as we navigate delegation items. And of course, once again, help us navigate delegation when we're in the clinical setting. So let's briefly talk about these 2 resources. The first one, the provider scopes of practice. So let's talk about each person's scope very briefly. The first person is the RN. So the RN is going to have the largest scope of practice out of anybody else on that nursing unit. We are taking care of all clients, whether they are stable or unstable. We have a big responsibility. And we are able to perform all steps of the nursing process. And we should be the only one as an RN that ever performs the initial steps of the nursing process. The teaching, the assessment, the planning, the evaluation. All of these things require clinical judgment. And we have spent many years in nursing school gaining a lot of knowledge in clinical judgment. And these things really come into play when we are performing the nursing process. So we need to use all that knowledge, and we are responsible for, once again, all steps of the nursing process. And we are also responsible for all tasks, even if they're non-routine, routine, non-routine. And so then let's move on to LPN or LVN. Now that is the same role. They are just called different things depending on where you live. So the LVN is also a nurse, but they can only care for stable clients. And this is where I'm going to go ahead and I'm going to just warn you guys to be very careful whenever you are doing any questions to not try to think about, wait, I saw this thing in clinical. Or one time whenever I was caring for a patient at the hospital, an LVN did this. That can get you in a lot of trouble because me personally, before I was a registered nurse, I was an LVN. And I oftentimes got asked to do stuff outside of my scope of practice, such as being asked to care for unstable clients and all kinds of other things. So please pay attention to the scope of practice and not necessarily what you're seeing in practice, because unfortunately it's not always correct what we're seeing out there. So getting back on track, LPNs can only care for stable clients, and they can perform some portions of the nursing process, but that's only if the registered nurse has already initially performed them, okay? So I know that's one little gray area that can kind of be confusing to students. So just to further clarify, LPNs can repeat certain tasks if the RN performed them first. So an example, they can reinforce teaching that the RN already provided. They can monitor assessment findings that the RN has, after the RN has performed the assessment. And they can assist the RN with care planning once that registered nurse has developed that care plan. They are only able to do routine tasks, so tasks that don't pose a lot of risk. Some examples are wound care for a basic wound, collecting specimens for a lab sample, those types of things. And then lastly, the UAP. And I will tell you, most delegation items involve delegating to the UAP. So it's very important to know this UAP scope of practice. They can only ever care for stable clients. They can never perform any tape tasks or any portion of the nursing process. They can only do routine and non-invasive tasks. Some common examples are vital signs, helping ambulate a client, and they can never administer any type of medication. So that gives you a basic overview of each person's scope. So that will certainly help us here in a second when we're navigating these questions. And then another great resource that we should always take into consideration are the 5 rights of delegation. All this resource is a series of questions we should be asking ourselves when we're trying to determine, is this task appropriate to be delegated? So that first right is person. And that's just asking, is this delegatee, this individual, competent to perform the task? Do we think that the person has the appropriate education and knowledge to be able to perform this? The second right is task. So is that task routine, or is it something that's going to pose a lot of risk to the client, such as an experimental treatment or something that we don't think that the client will necessarily tolerate well? And I'll give you some examples in the questions. And then we, of course, have to refer back to that scope of practice. Is this task within that delegatee scope of practice? And then the third right is circumstance. is that client stable? And can the RN supervise? So we all know that delegation is very commonly used, but it's really commonly used whenever we're busy. So here's kind of a little tricky thing is, a lot of times whenever we're busy, we want to delegate, but the RN must always be readily available when they've delegated a task to be able to assist, answer any questions, and help. And then one more really important tip for NCLEX I want to make sure you understand that kind of makes delegation scary is that we are always responsible for the outcome of the task as the registered nurse. So if you delegate a task and someone performs it and something goes wrong, you as the registered nurse are still responsible and accountable for the outcome. So we always want to make sure we're delegating appropriately. The fourth right is making sure that we give clear instructions on the expectations. So I can give you a perfect example. We wouldn't want to ask a delegatee, can you please go get vital signs and tell me if the blood pressure is abnormal? We want to be very clear and specific. We can say, will you please go get vital signs on this patient? Please tell me if their systolic blood pressure is greater than 120. And it's always important too to have a timeline so that so we can ensure that that client gets the care they need in a timely manner. So telling them, can you please make sure we do this in the next 30 minutes or the next hour? And then the fifth right is supervision. And we always, as the registered nurse, have a responsibility after we delegate to go back and make sure the task was performed correctly and that we evaluate the situation to make sure everything is good with that client. So I know that was a lot of information I just gave you, but those two resources, the scopes of practice and the 5 rights of delegation, are really the foundation of delegation. And so if we understand that well, we should be able to cruise right through these practice questions. So let's look at the first one. The registered nurse is supervising unlicensed assistive personnel, or UAP. And this is the most common way you will see a delegation item asked, is the RN supervising a UAP. So which task would be most appropriate for the nurse to assign to a UAP? Well, let's look at them. First option, perform incontinence care for a newly admitted client who had a cervical spine injury. Option 2, assist a client who had an above-the-knee amputation 2 days ago into the prone position. Option 3, reposition a client with increased intracranial pressure who has a decreased level of consciousness. And then our last option, demonstrate use of continuous passive motion for a client who underwent a knee replacement. So let's look at each option a little more closely. So option 1, do we want to delegate this to a UAP? It's incontinence care for a newly admitted client with a cervical spine injury. Do we want to delegate this? Yes or no? And I see a lot of you guys are giving me some guesses, and you're probably on the right track, but I think there's just as much learning in reviewing the wrong answers as there is in guessing the right one. So we're going to hopefully learn a lot from this by reviewing the wrong answers. So yes or no, do I want to delegate option 1? So I say no, and I see a lot of y'all are saying no. So let's talk about why. When we see incontinence care, we can think usually that is a routine task, but we have to always look at the context. We always have to look at the information that's actually in the question. So this is our key word, newly admitted client. I'm going to go ahead and give you a helpful tip for NCLEX. Anytime you see the words just arrived to the unit or newly admitted client, that, guys, is an unstable client. Okay, so we haven't even seen them yet. For all we know, they could be in there not breathing, no pulse. So that's a big old red flag that this is a high priority patient because they are considered unstable until we have seen them. Also, this client has a cervical spine injury. So whenever we are performing incontinence care, we know that it involves rolling a client typically if we want to clean them well. Well, when you have a client with a cervical spine injury, rolling them is no longer a routine task. This is a very high risk task. We know that we have to use a log roll technique, otherwise we can worsen that spinal injury. So there's 2 reasons this first option is wrong. The client is unstable because they're newly admitted, and incontinence care or turning a client with a spinal injury is not routine. So that is a big old no. I agree with all of you guys. So a lot of you guys are saying you want option 2 to be the correct answer. And I might agree with you, but let's talk a little bit more about why. So we have a client with an above-the-knee amputation, aka 2 days ago, and they need to be positioned in the prone position. So bonus question, why do you guys think we need to go ahead and reposition somebody following a above-the-knee amputation into the prone position? While y'all are answering, I see a couple people are asking, is this live? Yes, it is live. I'm here with you right now. So if you have any questions, feel free to ask. So prone position, above the knee amputation. Why do we do this? That is to prevent contractures. So if we don't position that patient occasionally into the prone position, they can get contractures in the hip area. So it is very common post above the knee amputation for us to position that patient a couple of times a day even into that prone position to prevent contractures. So for this is a routine task because it is repositioning a client. And we see this client had surgery 2 days ago. So if we are performing the care plan like we are supposed to, we should have already put them in the prone position many times by day 2. So this is routine, and the client appears stable based on the information we have. So I like it. I think you guys are right. But let's talk a little bit about the next options. So repositioning a client with increased ICP who has decreased level of consciousness. So although repositioning seems like a routine task, anytime we are repositioning a client that has increased intracranial pressure or is at risk for increased intracranial pressure, do you guys still think it's a routine task? What do you think? Is it a routine task or basically a task that poses no risk to reposition a client with increased ICP or at risk for increased ICP? What do we think? What happens if we position them in a supine position or we put the head of the bed too low? Can something bad happen? Yeah, absolutely. We can make that intracranial pressure increase even more. So this is actually very risky. It's not a routine task to reposition a client with increased ICP. So we want to, so we know that this is not a routine task, but also the client is having decreased level of consciousness. So do we think they are stable? Yes or no? Say no. A lot of y'all are already typing unstable, high risk. Yes, y'all are right on target. So this client is, anytime we have a client with increased intracranial pressure and we start noticing big shifts in their mental status, that's a bad sign. It's a sign our client is getting worse. So we certainly would not want to delegate this because once again, it's not a routine task to reposition a client with increased intracranial pressure and this client's unstable. And then option 4, demonstrate use of continuous passive motion for a client who underwent a knee replacement. So do y'all remember what that CPM is? That is the machine that helps make the stepping motion with the knee. So it prevents contractures post-operatively. It helps make sure that that client maintains good range of motion in that joint. So that seems routine, but why shouldn't we delegate option 4? What do you guys think? Option 4, demonstrating use of CPM for a client who underwent a knee replacement. Tika, I hope I said your name right. Good job, teaching. So NCLEX isn't always going to make it as simple as using the words you see in the nursing process, education, teaching. But when we really look at the context of demonstrating use of something, that's what that is. That's teaching. So that client is probably stable, but we never delegate steps of the nursing process to a UAP. So that is incorrect. Okay, so you guys rocked that. I'm super impressed. So let's see how you do on this one, because I know that all nursing students and people studying for NCLEX love SATA. I'm being sarcastic. I know y'all hate SATA. You know, it's pretty overwhelming when you see 7 answer options pop up on the screen. But we're gonna just take it option by option, and that's what you're gonna do when you go sit to take NCLEX. Is don't get overwhelmed. So the nurse is caring for 5 clients on a telemetry unit. So we're having a busy day on this unit. Which of the following client needs can the nurse delegate to a UAP? So I'm not even going to overwhelm you guys by reading all of them at once. Let's just go through them one by one and see what we think. Option 1, determining the pain level for a client that just received IV morphine. Yes or no? Do I want to delegate this to a UAP? Determining the pain level for a client that just received IV morphine. So this right here is actually kind of tricky, because when we're evaluating whether or not, or we're going back to ask a patient how their pain is after administering a pain medication, we are actually evaluating the care plan. We are evaluating a nursing intervention. So that is a step of the nursing process. Now, I know sometimes UAPs will go get vital signs and they'll ask a pain level while they're here or while they're in the room, but if they just received a medicine and we're following up, that is a client assessment and evaluation of a nursing intervention. Now, I know a lot of y'all are guessing a lot of right answers right now, and y'all are doing good. Y'all are on the right track. Option 2, assessing a client's ability to swallow food prior to feeding them lunch. So this one's probably the simplest one, because we can see right away the word assessing, and we know that is a step of the nursing process. And also, this is a very high-risk task. If that client can't swallow food and we feed them, what's going to happen? They're going to aspirate or choke, and they can develop some life-threatening airway and respiratory complications. So certainly, I agree with you guys. We do not want to delegate that. Option 3, assisting a client with pancreatitis to ambulate to the restroom. Yes or no? Do we want to delegate option 3, assisting a client with pancreatitis to ambulate to the restroom? I agree with you guys that we can delegate that task safely, because this is a routine task. Assisting the client with ambulation is routine, and all it says is the client has pancreatitis. There's nothing there to indicate that they are unstable. So this is a stable client, routine task. I love it. So option 4, assisting a client admitted with a myocardial infarction to perform oral hygiene. So do we want to delegate option 4, yes or no? Oral hygiene on a client with a myocardial infarction or heart attack. So oral hygiene is a routine task, and all it says is the client was admitted with the myocardial infarction. There's no indication that they are unstable. So routine task, stable client. I agree with you guys. Yes. Now this is where I'm going to give you one more helpful tip. Please don't ever read too much into an option or overthink it because you're stressed and you're nervous. You might say, oh, a myocardial infarction or a heart attack is, a very serious diagnosis. But all we're doing is oral hygiene. So don't start going down that rabbit hole, so to speak, because it can get you in a lot of trouble. Don't read too much into it. Option 5, performing perineal care or pericare on a client with an indwelling urinary catheter in place. So do you want to delegate option 5 to a UAP, yes or no? Performing pericare on a client with an indwelling urinary catheter in place. So Quint, I see that you put that as my issue, reading into, options. You're not alone in that. I used to do the same thing as a nursing student. It's a common issue. So remember, guys, only look at what that question is telling you and just trust that that's all you need to know. Don't add information to it. It's a good way to get in trouble. So a lot of you guys are saying, yes, delegate 5, and I agree. Pericare is a routine task, and all it says is our client has an indwelling urinary catheter in place. So it's routine, they're stable, yes. Let me give you an example of when this client might be unstable and it would be inappropriate to delegate. Maybe it says performing perineal care on a client with an indwelling urinary catheter in place with bladder distension, with no urine output, with blood at the urinary meatus. All of these things would indicate that client is unstable and we should not delegate it. So option 6, recording the intake and output of a client with a history of CHF. So do we want to delegate option 6, yes or no? Intake and output on a client with a history of CHF. So once again, recording intake and output on a stable client, because all it says is history of CHF. So routine task, intake and output, stable client, I say yes. Let me give you another example of when this would be inappropriate to delegate. just so you kind of know what to look for when you're doing an exam. If it said recording the intake and output of a client with a history of CHF who has pink frothy sputum. What does pink frothy sputum indicate? I'm going to let you know that's a big red flag. If you ever see a test item that says a client has pink frothy sputum, that's a very bad, very ominous finding. What do we think? So that's going to be pulmonary edema, flash pulmonary edema, very dangerous. So if it said recording intake and output on a client with a history, with the history of CHF that has flash pulmonary edema, then that would be a no for delegation, okay? So last one, and this is the one that I think is the hardest, that students struggle with the most. Performing vital signs on a client that just returned from the cardiac catheterization unit. So do we want to delegate option 7? And once again, this one is a little challenging because one of the most routine tasks that we ask UAPs to perform quite often is vital signs. But remember, we always have to look at the context of the item. So let's see. Paul, good job. You said unstable client, and that is correct. This is another helpful tip. Just returned from the cardiac catheterization unit. So remember on the last item, we said anytime it says just arrived, just admitted, same thing here, another helpful tip. Just returned from a procedure, they are unstable. So that registered nurse is actually the one who is responsible to go to that bedside, assess that client, and get those vital signs. So that is an unstable client. So awesome job, guys. Y'all got them correct. 3, 4, 5, and 6. Okay, so now we're going to do one more thing. We're just going to shift gears completely. I've talked pretty much all about delegation at this point, but I really haven't talked much about assignment making yet. So assignment making is very, very similar to delegation in the sense that we have to have a really good understanding of everyone's scope of practice. And you will see assignment making questions very often on NCLEX as well. And these questions are asking you to determine an appropriate assignment for another RN or for an LVN. So let's do one of those together and get a little more practice and familiarity with this type of item, because there's a good chance you'll also see it on NCLEX. So it says a charge nurse is making client assignments for a critical care step-down unit. Which client would be most appropriate to assign to a new graduate registered nurse? So before I go ahead and confuse anybody, I just want to reiterate, the RN technically can care for any of these clients. Remember, the RN scope of practice is we can care for anyone, no matter how stable or unstable they are. But remember, guys, we are in a fancy, perfect NCLEX hospital where staffing is amazing. And so we're saying which is most appropriate. So let's take a look at the options. A client admitted for diabetic ketoacidosis on an insulin drip. A client who is scheduled for discharge today with a new colostomy. A client who is scheduled for a pacemaker insertion procedure during the shift. And a client admitted for post-operative infection who is receiving IV antibiotics. So let's take a closer look at each option. Option 1, a client admitted for DKA on an insulin drip, which means IV insulin. So do you want to assign the client in option 1 to a new graduate registered nurse? Yes or no? So I think that we should probably try to find a more experienced nurse for this client, and let me tell you why. We know that DKA is a life-threatening complication of diabetes, and it is a very complex care plan. And we know that IV insulin is one of the highest risk medications we will ever give. It is a very, very potent medication. For example, if you're not very familiar with the IV system and you accidentally bolus an insulin drip, there is a very high likelihood your patient is going to code and potentially die. So it is a very, very high risk drug. But also, we know that it really affects the electrolytes. So whenever a client is getting IV insulin, their potassium level is fluctuating the entire time. So if we don't very closely monitor this client and we're not very careful, they can have cardiac complications as a result of potassium abnormalities. So we know just by having that really brief discussion, this is a very complex care plan. So we would want a more experienced nurse to care for this client if possible. So option 2, client scheduled for discharge today with a new colostomy. So do we want to assign the client in option 2 to a new graduate nurse? Yes or no? They seem pretty stable if they're being discharged today, right? So why would we not want to assign them to a new graduate nurse? Well, we have to look at that keyword, new colostomy. With a new colostomy, what is that going to require? A lot of education. So this client typically needs a lot of information on care of the site to prevent excoriation or infection, but also a lot of psychosocial teaching to help them adjust to this big change in their appearance. And so really, it's ideal to have a more experienced nurse that is very familiar with wound care and colostomies. So I agree with you guys. I don't think it's the best option for a new grad nurse. So option 3, a client scheduled for pacemaker insertion. So what do we think? Do we want to assign this to a new graduate nurse, the client in option 3? So a client that is getting a pacemaker insertion, when they come back, they're at very high risk for cardiac arrhythmias. Sometimes that pacemaker doesn't properly pick up right away. They might have issues with cardiac output. So we really want a nurse here that has a lot of experience with ECG rhythm interpretation. So it's best if an experienced nurse is able to care for a client post-pacemaker insertion. So I know you guys have been telling me option 4 is the correct answer for a while now, and I agree with you guys. And the reason for that is because it is the most simple care plan. So that's really what we're looking for. With a new graduate nurse, of course, new grad nurses have tons of experience and knowledge, and they're very smart. But we want to make sure that they are assigned the simplest care plan if possible, because that is going to be what is safest for both that nurse and that client. So a client that's got a post-operative infection with IV antibiotics is a very simple care plan that would be appropriate. Now let me give you an example of when this maybe wouldn't be correct. So a client admitted for a post-operative infection who is receiving IV antibiotics, who has tachycardia, hypotension, and an elevated lactic acid level. So this is just a bonus question because you guys are doing so well. I want to try to challenge y'all just a little bit. If you have a client that has an infection that has tachycardia, hypotension, and an elevated lactic acid level, what is going on? What do you think they are experiencing? What condition? So that's all. Those are all indicators of sepsis. So certainly, sepsis is a very complex care plan that typically involves central line, hemodynamic monitoring, vasopressors, titrating medication. So that would be something also that would be assigned to a more experienced nurse. Okay, so once again, that is the correct answer. Y'all are doing awesome. So in summary, I guarantee you guys, you are going to see some delegation questions on NCLEX. It is one of the biggest safety topics, and you will certainly see delegation, and high likelihood you'll see assignment making. And we always want to remember our 2 helpful tips that help guide us as we answer these questions, that we never delegate the nursing process, and we only delegate routine tasks for stable clients. So I know you guys might have some questions, and once again, there's kind of a delay in the chat. So while y'all are typing up some questions, I want to show y'all something really cool we've been working on here at Bootcamp. So you might have already heard about it on social media, on Reddit, or just from friends. We have been working on some cheat sheets that are phenomenal. We have been trying to take the guesswork out of everything for you guys. We're looking at all the resources and trying to figure out what do they need to know without any extra information. And we've done a great job of it. So we do have a cheat sheet on delegation and assignment making that goes over a lot of the stuff we just talked about, but it also has some extra resources like this really cool flow sheet that basically helps you guide you through the process that we just went through with each of these questions. So please check us out. Let me actually show you while you're typing in some questions for me. our website. So bootcamp.com/NCLEX. Right when you get there, I know this is going to sound too good to be true, but you can go to these cheat sheets for free. So they are free right now. So I just showed you delegation and assignment making. There's all kinds of topics you can see here that will help you both if you're studying for NCLEX or if you're in nursing school. So please check that out. It is a phenomenal resource. And please follow us on our socials. I know Miss Miriam is sharing all of these links in the chat. Let's see. So I've seen a lot of people ask about the specifics of if an LPN can give IV medicines or IV piggyback. So I will tell y'all that is a very tricky gray area because a lot of the scope of practice with an LVN can kind of vary depending on the state. So a lot of times NCLEX keeps it much more general. So refer back to that scope of practice. And so some areas they are able to do certain things, not others, but I will tell you NCLEX does their homework. And so if it's something that varies from state to state, they're not gonna ask it. It's gonna be something very general to delegation. What else? Any other questions you guys have? Is it true that they took math off the NCLEX? So Dawn, my understanding is there are still drug calculation items on NCLEX. Okay, so any other questions? Thank you guys so much for joining us today. Where can I find the video? So you can find all of our webinars that we've done in the past on the YouTube channel, the Facebook channel, and also please certainly follow us because we have these webinars weekly. So you can watch this video again and of course attend any future webinars. Okay, guys. Well, thank you again so much for coming. I hope you learned a lot today. And I really enjoyed talking to you all guys about delegation and assignment making. Have a wonderful rest of your day.